thought that it was important for us to meet at this point, just to do the briefing, the update, which we normally do after we've had a meeting of the Interministerial Committee. We have been here in Limpopo. We've had several meetings. So before I go into some of the issues that brought us here, I need to just reiterate the fact that this morning we issued a statement. I also want to say that of the statements that we issue, we have promised the media and the public that as soon as we get results, we would like to release them so that we ensure that there's proper transparency. But at the same time, we also want to make sure that the media does not get forced to decide whether to believe any leaks or not and any fake news. So we then have said that we will announce all the results as they come. The good thing on that approach is that we will give you the information as soon as possible after it has been made available. The difficulty for us in that work, in doing that work, is that we often take a while to verify a number of things. Sometimes we go back to the tests and so on. At the workplace, you will find that there will be mistakes and corrections that need to be done. And so we decided when we give you information and we thought there was something that needs to be corrected, we'll correct it in public again so that we can just ask you to keep the correct record. Now, the last time we met, we had reported 13 cases were tested positive on the coronavirus. This morning, we announced 17. Now, I just want to describe something a little bit for you to understand so that we can put in context some of the challenges that we need to just correct at this point. Normally, when someone has got a test that needs to be done, up to now, we've been doing the tests in one center. And the center has been the government-owned National Health Laboratory Services. So we would then do the test in one center and then release the results. But we did indicate that we are ready to match up the escalation of the infection. So we have now started introducing another element on the testing, and that is to decentralize the testing to various provincial laboratories, as well as to incorporate the private sector laboratories in the testing. But we have said also that the tests, before they are finalized, the ultimate verification has to be done in the National Health Laboratory Services. Before we announced the last results last time, we also described a case of someone who had tested positive, and there was a rumor about them, but then in the process, they were then subsequently withdrawn from the report simply because we verified the results and then we found they were negative, and we took that as a conclusion of that particular matter. Now, this is going to arise every now and again for various reasons, because firstly, the level of sensitivity of the tests in terms of different laboratories would still require verification at the National Health Laboratory Services. We are not sure about possibilities of cross-reactions and so on, so we can't explain why some tests will come out a little bit positive and then later on we verify them, they appear negative. In this case, there were 17 cases that we reported. One of them was reported in the Free State, and it was indicated that this particular patient did not have a history of traveling out of the country. So we were concerned about these results, but they had been done by the private laboratory. And when they'd seen the results initially, then they decided to go to the patients to alert the patient to take specific precautions, because you have to actually deal with the patient and make sure that they are able to understand the questions of contacts and the extra precautions that have to be taken and so on. So on that basis, we actually released the results with what was positive at that point. But because it did not fit the proper case definition, we then wanted to make sure that additional verification was done. This one has since been done and confirmed to be negative. So that is something that happens every now and again. It's not a crisis as far as our situation is concerned. It's just that because of the new processes of incorporating the private sector laboratories, there's quite a lot of tightening that we have to do about it. So we've asked that the head of our laboratory services must also embark on an investigation just to make sure we do not run into problems in the future. But I've also invited private laboratories to a meeting on Saturday so that we can strengthen the protocols and make sure that whatever work we do, it actually comes back with less and less challenges in between. So this particular patient, whilst has been unwell, we now want to indicate that the results are taken as negative after all the verifications have been done. It's not different to the one that we had reported last Monday, where we said that we're just mentioning it for you to know that when there is a story being told about it, if we didn't do that, you would have had a challenge where someone will say, but we know this was reported by the doctors, and then you would start thinking that there is information that's hidden from you. So we want to be upfront and transparent about it, but we will make sure that we tighten up at that level. The approach is for the results to be finalized, whether the individual would have done them at private hospitals, at a private laboratory or public laboratory, it has to be verified through the National Health Laboratory Service and NICD. And therefore, we will in future just make sure that this kind of lapses doesn't happen again. The authority on the coronavirus test is the National Health Laboratory Services, which is a government entity. It's a reference laboratory for South Africa, but for the rest of the continent is one of the two that have got that status. So the results, once they come from the National Health Laboratory Services and the NICD, then it becomes final. So this one becomes final at this point, and therefore we will want to deal with that issue. Now, there's a subsequent issue, so we want to publicly, and at this point, indicate that results which were said to be positive will be withdrawn because we have now got it properly corrected. Similarly, what was the challenge was that the particular person did not fit the case definition, which is what we normally are looking out for. There has to be also a way of trying to find out the source of the infection, the contact with a particular area where the infection is rife. In this case, the person had not traveled outside. Now, as a way of just describing the contacts and so on, we had mentioned that the individual had worked with a Chinese businessman, but not that he had been to China or any part where the infection is rife. Now, we want to indicate as well that that reference has a challenge of being subjected to misinterpretation, because when that was raised, in fact, it was not supposed to mean that someone was confirmed as having been positive and therefore that contact. So in the first instance, that such a reference should not have been made. So we want to indicate publicly we withdraw that and we regret that such a reference was made. We do not have a record of anyone, whether a businessman or not, who has got any connections with China here that has got an infection or that has got a possibility of infecting anybody. For that reason, we want to just apologize and retract that. So again, I think the public should really bear with us. When such things happen, we'll just come up front and deal with it, because this issue of coronavirus is not a departmental issue. It's a societal issue, so there must always be transparency about it. So that is the second aspect that we wanted to table with regards to this matter. Another matter which we would like to also put on the record is that for the past few weeks, there were students who came to from China, from TVET College, who came to Limpopo and several other provinces. Now, somewhere along the line, during the course of the past few days, there's been quite a lot of speculation about the status of these students having come from China, whether in fact they had the infection, coronavirus. Now, we knew that they were not at risk. However, with mounting speculation, we felt that it was important for us just to take a necessary precaution, just to make sure that this matter is put to bed once and for all. So between ourselves, the provincial government of Limpopo, the Premier, the MEC, we discussed the matter, and it was all agreed that these students must actually be called so that we do the tests and then allay the fears of the public in this matter. I want to announce here that there were 14 students who were tested from Limpopo, and of these students, when they came through, they were tested, and yesterday they were tested 2 days ago, and today the results have come up. They are all testing negative of coronavirus. In other words, the fact that they came from China should actually not cause public concern that they could be carrying the virus. They do not have an infection. They did not test positive for the coronavirus, and we only tested them just because we wanted to make sure that the community concerns were really just anxiety and not that they were based on anything that could be clinically justifiable. So those students have not been infected, and we want to again say that it was done just to make sure that when the debate is going on in the public arena, people must know that those students are not at all affected. And so we want to put that issue behind us as well, and I want to thank the provincial leadership, particularly the MEC, who is a doctor, who are there to actually make sure that she personally supervises the process. And that, for me, is leadership. We want to put that behind us. So any other people who come from any other part of China other than Wuhan and Hebei are not subject to any form of investigation. And we will not investigate them. We'll only treat them like any person who has come from any part of the world where there are no serious challenges. It's only the people who come from Wuhan and Hebei that we were about today. So I want to put that issue behind us. Then I want to then take the media and the public to confidence to say that when the cabinet met and discussed the issue of repatriation of South Africans in Hubei and Wuhan, this was the announcement that was made by the president, and the president had actually instructed that an interministerial team working together on the issue of coronavirus should meet and therefore work on the logistics of bringing these South Africans back home. This was an act of it was a humanitarian act based on the fact that there were students who were in Wuhan and Hebei province who had finished their courses and needed to come back, but were asked to wait whilst there was a lockdown in Hubei and Wuhan. Then, in the course of our discussion, some felt that the quarantine was taking a bit longer, and they started getting anxious, wishing to come back home. Their families did make representations to the president, to DIRCO, and asked that their family members should be brought back to South Africa. Initially, on the first week when this matter was raised about coronavirus, we actually took a quick survey and phoned 34 of the South Africans who were in Wuhan, and 33 of them said they were not really wishing to be brought back. Only one was wishing to be brought back. So we monitored the situation every week, because every second day, every third day, there was a direct contact by the staff of the embassy in Beijing to find out what were the concerns of those South African citizens who were there. There were a number of issues raised. Amongst them were those who had a problem of challenges with the food supplies only when the food supplies had run down. But when this was corrected after we discussed with the Chinese government, then of course they came back to say, no, that has been corrected. And some of them even posted videos to show that they were okay. So for most of the time, they were quite comfortable. There were those also who had certain challenges, such as special medication, which they couldn't find in China, that would make special representation to actually dispatch medicine so that they can maintain themselves. But we want to indicate that none of them were ever reported sick. None of them were ever reported to be positive, testing positive for the coronavirus. And therefore, the idea of getting them to come back to South Africa had nothing to do with any concern about the healthcare system in China, had nothing to do with the fact that they would have been sick or anything like that. It was really on a humanitarian basis. And that's really on the basis of which we decided to go into this program. Having done so, the president then had instructed the South African National Defence Force, whose duty it is to ensure that South Africans that need to be rescued or removed from any other country are actually brought back safely into our country, is the duty of the South African National Defence Force. So this then meant that the South African Defence Force had to take over managing the whole process. As a result thereof, we as the ministers, as we met what we call the top command of the military of the South African National Defence Force, met and then appointed a team of those generals who were in charge of the logistics, those who were in charge with the rescuing, the isolation, prevention of infectious diseases and dangerous conditions, such as if there would be any contamination and so on. All of these were the experts that had to take over the process of preparing for the return. Certain conditions had to be put in place in terms of what criteria needed to be fulfilled to be able to bring these people back. We did announce that there were 3 phases of the process of the removal or of bringing the people back. The first one being that is the evacuation, which means getting aircraft, getting a crew and team that must go into Wuhan and collect the South Africans and bring them back. The second aspect was the quarantine, which was about ensuring that we could observe for the 14 days to see whether any of those South Africans could have by any chance had an infection, and therefore we would then subject them to the tests and so on. The third one is reintegration to society. This one basically means that we would have been able to confirm that the individuals are free of the infection and are free to join their families, and therefore would need to meet and look at the circumstances to see whether the issues of acceptance and issues of stigma and so on, particularly with so much of negative social media, it becomes important for us to be able to say we need to give that some attention. Now, those were the 3 phases that we had to work on. Many of you were asking every other day, when are they being fetched? When are they coming back? Well, at least now you know that the crew did set off. The president was at the airport to bid farewell. And I must say that this is not a usual airline program. So everyone who participated there were volunteers. They could well be working for government or working for a state-owned enterprise, but actually they were there on a voluntary basis. We have been humbled, and we really felt, touched by the gesture of all those South Africans who decided to raise their hand to say they will be the ones to take this mission. Starting from the chief pilot of the South African Airways and a group of pilots and engineers who volunteered. Unfortunately, the media may not have met them because at the time the president was there, they were actually already in the aircraft, but we subsequently went and met with them. They were in high spirit, they were very excited, and they actually said they're doing it for South Africa. They do want to have something they do as a contribution to their own country to actually go and help their fellow citizens and get them back to South Africa safely so that they can join their loved ones. We also have a huge crew, probably about 18 people, who we went to go and meet inside the aircraft. Again, these are people who do work as a crew, but they actually took this one as a duty to the nation. And again, their spirits were very high, they were very, very happy, and they really appreciated that they had an opportunity to serve their nation. And I can tell you, wherever they are, they send to us messages on a day-to-day basis to show us that they are still fine. Then there was also a contingent that came from the South African Military Health Services and the military. These are now to go and look after those people when they come back, on the basis that in the process they need support, whatever they need intervention on. Some of them are medical officers, so they are there just if in case there's any issue that relates to the health of our people there. So this was the team that left, and the president went to bid them farewell and as a commander-in-chief, and so this whole team has really gone out there, and I think we all be aware that because of the planning, they had to take several days. Now, the reason why it's several days is because China has still got lots of restrictions in terms of traveling to various parts. We also want to make sure that they just focus on the part of China. There shouldn't be any question about where they've been, a South African aircraft, and so on, so that there's no question when they come back about whether they could have, in any case, gone to various parts of the countries that could have been having any challenges or any infections or any quarantine or any lockdown or anything like that. So they've taken care of that. I will not be in a position to give you all the stations where they went to, other than to say they sent a message, as they said, they are fine. And for that reason, therefore, we expect them to be back before the weekend is over. And as you'll appreciate, we are all not military people here, so we will not go into the details of what the military operations, the planning thereof, and the timing is not our real duty to be able to give you that. But we want to say that we had the top generals. If I'm not mistaken, there were 3 generals who were involved. One was a general who is on the evacuation side. Then the other one is a general on the logistics side, and the other one was a general on the military health service side. That decided then to embark on the plan to look for the most suitable site for where we should be conducting the quarantine. And amongst the issues that were important on the quarantine is the issue that these are South Africans who are not sick. So we're not taking them to a hospital. So we're not looking for a hospital. There are also South Africans who are free, and where they are not under detention. They are just relaxed, they're just waiting for the day to come back. So because of that, we needed to make sure that they come to a place where they can be made comfortable, where we can observe them, where they can sit and enjoy and be able to call home and relax, have no real challenges, except that they can't meet their families. There is no other restriction. Now, a few of us here have been into circumstances in our history where you had to spend time alone, where there was no communication with anybody, where there was no access to the outside world. That is very, very uncomfortable. But now, if we're coming from a place like where our citizens are, you're supposed to stay put where you are. So this means that when they come back, we want to encourage them to stay as much as possible in their rooms. That's what the quarantine is going to be like. But we want to confirm again that they are not sick, they have no symptoms, that they are also negative on coronavirus. There's no reported infection or any presence of the virus. So when we bring them here, it's a statutory provision for us to allow them 14 days since the removal from the source of the infection. They are not the only one. The others who are in the Diamond Princess, they called us to say, what should we do? When we may advise them that those who are sick get treatment. And only when we are reported to be healthy and negative of the virus, you'll come back through commercial airlines. We made that announcement here. The other ones, we said you're going to stay in quarantine, you are negative of the virus, you got 14 days to confirm that the virus is not coming, you have not contracted the virus. And because of that, they are still out in Japan. All we had to insist on was that the 14 days start after they left the ship, because the Diamond Princess ship was initially thought to be a quarantine, but in fact, there was too much mixing of people there. It ended up with 706 people being infected and about 6 or 7 of them dying. So because of that, we want to say they need to be out of the infected area, clear 14 days, and then they come back. So that's what's happening to those who are in Japan. So this lot that is coming, we have given them the same approach, and that is they will be 14 days after leaving Wuhan. If before they left Wuhan, we don't count it because the outbreak, the coronavirus is endemic in Wuhan. In other words, you can walk all over Wuhan, you have a chance of contracting the disease. Only when you get out of Wuhan, we start day one. So that's the difference. The second difference with anyone else is that when they come here, they are not people who are sick who have gone to see a doctor. So we can't say go and sit on a home quarantine. They are government responsibility to look after and make sure that the quarantine is done properly. So that's why we ask them to come back. So the generals were then given to the specifications, amongst which was the people need to come back to South Africa, any part of the country. The people need to come back to a site which is away from human habitation. There mustn't be communities nearby so that there are no mistakes of people getting to wander into a quarantine area. And thirdly, that it must be an area that is so isolated that it is possible to create 2 lines of a perimeter security patrol. They will be patrolled by the army, they will be patrolled by the police. This means, therefore, that there is no chance anybody can mix with the people. We only are observing them. They are not criminals. They are not sick. They are not patients. They are just South Africans that are waiting their time for the virus to burn itself over in case there could have been any, so that 14 days can tell us what is happening. So then the issue was there were a number of people who were living in single rooms as individuals. We need to make sure that that number is catered for so that those people must be able to get the freedom and the privacy of living in a room, their own rooms. The other one was that there are others in that group. 8 of the people are families who are 19 people in total. Now there must be houses which accommodate those units of families so that the family is not separated, they live together. Now they went through the country, 84 sites that they went through. The first one, I recall, they spoke to us about a wonderful site in Uppington. But when they described it, it was a bare felt where if there was an army that was involved in this operation, they would have just put up tents and then that would have been it with sleeping bags, and that would have been enough for the soldier. But we said, look, these are not soldiers. So they don't go camping, they don't do tents, they don't do sleeping bag. They go into a room and so on. So this is the kind of thing that we're to do. And then, of course, there must be continuous, proper catering with normal food, which any South Africans should be able to feel that they are being dignified in the way that they are being managed to deal with their responsibility. So those were some of the issues. But in addition, there had to be a nearby landing area. These are some of the issues that had to be looked at. So 3 areas were ultimately shortlisted, and each time each one of you was asking, they would ask, we heard you, people had gone to this place, they'd gone to that place, and we said, yes, they did have. In fact, you haven't mentioned others. They went to other 84 of them. One of them was Tabanchu, and the challenges with Tabanchu was that the numbers of rooms did not quite fit this situation, and the army was not sure about the size of the airport that was available to be able to carry the size of the aircraft. And because of that, it meant that then a few other things needed to be done, and of course, that was the challenge. The second one was an area outside KwaZulu-Natal, outside Vryheid, called the Tala Game Lodge, Jondwe. And then, of course, everything was done. Everybody went there and surveyed the place, except the place is wonderful in terms of the location, except the problem was that the rooms, there are quite a lot of chalets and rooms which are close to one another, and rooms where you've got one room and several beds. So you count the beds, it looks nice, but when you count the rooms, then they actually come running short. So because of that, that was one problem. The other problem was that the nearest airport that could carry the aircraft was too far. So it was very difficult to actually land in King Shaka and drive 4 or 6 hours into the thing. So that was changed. Then, of course, the generals had gone to the last venue, which was Limpopo. They found this one to be ideal, and therefore they raised this thing. I can just indicate to you that these things were taking place at a very, very short space of time. The long and short of it is that we have now, a decision has now been made that this site is the one that will be used. There's been agreement signed with the owners of this particular place. There's also been work that has been done with the staff, and all that has been properly done, negotiated, and put behind us. Now, we want to just confirm, we thought you, as media, you must come in here today, because it's the last time you'll ever come here. After this place is a quarantine area. No media is allowed, no flyover is allowed, so you can't even send a drone out here to come and take photos. You can't do anything. No police can come, no other people can come in, the police are here. Minister Cele was smiling as we came in, because when we got to the gate, the first set of ministers who came in, they were asked, where are you going? They said, we're going to the ranch. And they said, sorry, please park on the side. Yeah, but we're going inside. They said, no one is coming in. But when we've got ministers coming here, they said, well, our order is that no one, not even ministers. So there had to be arrangement to get them to come in. And we thought that happened to them. We had the same thing. We had to be stuck there. So we said to the Premier, please understand that you were also blocked by the police. Their instructions are very strict. Now we're happy, because that's how it's going to be. This coronavirus is an issue of a public health emergency of international concern. The Commander-in-Chief has issued instruction that this must be managed by the Army. Here is the law of the military. So all of us are going to get out of here for good. We won't come back. The quarantine is going to be about people being here. They'll be asked not to mix in big groups, and they must also wear masks if they are going to public places. They'll be given all the necessary protective clothes. They'll be able to move around. They should be able to get they will have their meals. What did I do? Oh, okay, I'll just use my voice. Thank you. Thank you. So what it means is that they'll just be under observation. But if for any reason someone falls ill or someone is found to be positive, they'll be removed from here, immediately evacuated to be taken for treatment. So here, they will not stay anyone who is either sick or has got any evidence of the presence of coronavirus. People who are going to be here are just under observation. I'm making this point continuously because I think it's important for the fake news not to affect our people, to think that we've brought in sick people in Limpopo. There's been a lot of concerns, and some people were saying that we're bringing sick people into this area. There are no patients we're bringing here. There are no sick people that we're bringing here. And the people who are here are not going to mix with anybody, so they're not going to infect anybody. In fact, the crew, the pilots, the staff, the police, the soldiers are all going to be quarantined. They're going to be here. So all in all, you're going to be having quite a number of people here. So all of them agreed, they understand. The crew knows they're going to be here, stay with their people for 3 weeks, and then they'll be out after that. So that is what the whole issue is all about. We have also then engaged the workers. We have made it quite clear that this is a voluntary operation. Whilst they are employees here, they are free to actually work together. So they've raised certain areas of concern. They negotiated certain benefits in the process. I won't go into that because it's their issue. I can just say that we have been quite humbled by the contribution of, I'll mention this one company, and that is Momentum, who have come on board and said they'll partner with government to offer a limited life cover for a number of months, which has been negotiated with the workers just to make sure that no one feels uncomfortable and unhappy here. So they will also be checked so that everyone must be healthy here. All of those things are part of the arrangement that we have put into this. So when we leave here, we will leave the people who are going to be looking after this place to wait for the South Africans to come in. Now, having said so, I may as well just mention to you that the private sector is coming on board to assist in the coronavirus. Already, some of you, I'm not sure how many of you are lucky enough, you could have already received a message on coronavirus that comes from Vodacom. Those who would have must know that this is a contribution of that particular company in the fight against the coronavirus. We are calling on private sector to rally around working together with government to deal with it. I'm aware that there are many more private sector companies that want to come and work with us as we fight this coronavirus. This is what the president has been talking about. South Africans, when united, will be able to fight this infection, and we can do quite a lot about it. We've already started meeting up with some of the stakeholders. From next week on, you will be able to see that this interministerial team is going to be working out a program where a number of stakeholders will be engaged from next week on, so that particularly the churches, the arts and culture groups, the musicians, the sports people, to transport people and so on, so that we engage with them to look at what needs to be done to fight this coronavirus. So with that, we just want to therefore say we appreciate the private sector having come on board and want to call on more of the private sector to come and join us in this fight. This is a national fight. This is a fight against an infection that's all over the world, and we believe that these contributions go a long way towards everyone understanding that no one must stand by. We must all stand together and fight this virus. In fact, only if we stood together are we able to fight this virus and defeat it. We need to deal with the myths. I've heard today of a myth which I never understood why people start having this kind of thing, that coronavirus looks at the pigmentation of the individual. The darker you are, you won't get the virus. Please, let's not get that kind of fake news into our minds. Coronavirus doesn't look at your passport, doesn't look at your nationality, doesn't look at your circumstances, whether you are rich or poor, doesn't care if you are within 1 meter of somebody sneezing and has got the virus, droplet infection will hit you. So we need South Africans to know wash your hands. When you cough, you use a tissue. When you sneeze, you use a tissue. When you stand next to people who are talking or singing or coughing, sniffing, sneezing, then you stand a little bit of a distance. If you are more than a meter away, you are not likely to be infected. If you are less than that, you stand a chance of being infected. But for those who are in our hospitals, they've been well trained, they know how to use protective clothes. And we talk about this as isolation. In the isolation ward, you will come in, the nurse will come in, take off the clothes, or the doctor, then scrub, and then go and get the protective clothes. We call it PPE. That means the hat, the goggles, the mask, the protective clothing. With that, they go and see the patient. When they come back, they drop it there in that area. Then they walk back to clean themselves and move on. They can move back home without a problem because they are clear about it. We just need to make sure you don't break the infection cycle. We are out there also tracing the numbers of contacts, and we'd like to say, when we say home quarantine, it's a voluntary quarantine. So please respond and stay at home. And if we say stay at home on a quarantine and you don't respond, then the law allows government to go and actually enforce the quarantine. We don't need to do that. So we just want everyone to know. So for example, in this area, anyone who will wander into this thing, if by any means it so happened that they land in this area and maybe the army, the soldiers didn't see them, maybe the police didn't see them, one thing you must know, they'll never leave. They'll have to stay here in quarantine because they can't come in, get infected, and go out. If there's a potential for them to get infected, we'd rather stay here and say for 14 days, for 21 days, we want to make sure. Why do we make it 21 days? Is the first 14 days is mandatory for the incubation period. Then we start doing the tests. Because there are many people that are going to be testing, we're allowing a week so that we must be sure that whoever was here has been properly tested, and then therefore when they leave, they are actually free of the virus. So, ladies and gentlemen of the media, we're going to continue to work with you on this issue. We really want to thank you for your interest. We also want you to always work with us so that we can deal with fake media. The panic, the anxiety, and the anger, and the discrimination against people who might be having exposure to the virus, those things are more dangerous than the virus itself. We did talk last time on the conference that 80% of the people have got a mild infection, they don't need treatment. Only the 20% can need treatment, and those 20% are the ones who might end up coming to the hospital. Don't be surprised if you hear someone is positive, what are they doing at home? They are at home because there's nothing for the doctor to treat. They are also at home because the doctor does not give injection or tablets for the virus. They do treatment for the conditions and the symptoms that the patient has. As soon as those are over, we no longer need to keep the patient in, as long as the patient is going to stay away from spreading the infection. That is where we are. I want to leave it at that. I do know that I've dragged for quite a while, but I thought that it's important for us to explain a number of things, particularly because you've been asking lots of questions, and I think today we've answered all your questions. With that, I want to hold it at that. Thank you very much. I'm not sure if my colleagues want to come and say anything in the meantime.
That was comprehensive.
Okay, maybe we'll take your questions. My colleagues will answer them.
All right, thank you very much, Minister. So now, guys, from the media fraternity, we'll take 5 for now, then we go to the other side. And we have got our principals here. So you have to mention your name, where you come from, your media publication, as well as your position there.
Alex Matlala from the Citizen Newspaper. It's really a public knowledge that in a few weeks, I think it's public knowledge that in a few weeks, the Pope will be welcoming millions of people into the province, going to the ZCC or the repatriates. And therefore, we wanted to understand, the question is there in play in your government, in your department, Minister, to make sure that we cap the spread of these very dangerous diseases, where people are in public spaces cannot even want to choose? That's the first question. The second question is that is there any travel restrictions that you are going to introduce in South Africa? We have realized that in the United States and in India, the two countries have introduced travel restrictions. And the third one is that we wanted to understand that you have spent 25 billion rand in repatriating the 122 people from China to South Africa. And we also understand that when you went, you were charged over 8 million rand. How much are you charged here in the Ranch Hotel for the 21 days that the people will be stayed here? Thank you.
So, Femkona from the SABC. Minister, I just want to find out, we've dealt now with issues of how to prevent infection and evacuation of South Africans. You have explained that. But let's look at the economic impact of this challenge to the country. Has Cabinet looked at ensuring that in terms of the economic impact, that is minimized? When you look at what the Fed of the US did in terms of reducing interest rate or cutting of interest rate, the European Central Bank today had a meeting, they were also looking at that. And other countries have availed resources from their treasury to capacitate the Department of Health and perhaps in this case the Department of Defense, because this was not budgeted for. So did Cabinet look at economic measures, but also to support business because they might be affected? Tourism, we are told that already it is suffering. And then the last question directed to the Premier. Premier, we know that there is some resistance in terms of these South Africans coming in your province. Are you engaging the people of the province using all the platforms in terms of media to communicate the message and also to answer questions so that South Africans get a better understanding of what is happening? For example, what the minister has been saying. Are you sharing enough information and availing your exco to really go and answer pertinent questions? And the final one, Minister, on this travel ban, did you as Cabinet look at travel restrictions, particularly the people from those countries that are affected, like your Italy, like your US in this case now, I mean Egypt on the continent? Did you discuss that at Cabinet level?
Good evening, I'm Chriselle Lewis from SABC Television News. Just in addition to my colleague Sophie Mokwena's question, when, if at all, did the engagement start with the people of Limpopo on the decision that was taken to bring the more than 120 South Africans to the ranch? And Minister, the next one is to you. I understand totally that scientists and everybody else is still trying to understand the coronavirus, but this is exactly what creates panic. A statement that is sent out while there is a case now that you have to withdraw pertaining to the incident in the Free State. I mean, just judging by social media now, we've played our responsibility as the media to try and put out statements that are only released by you as the health department. Now, you have people saying, what is going on? How do we trust that the process itself can be credible and convey that message to South Africans if tonight you're going to retract one of those and get rid of the panic? Thank you.
Tara from ETV News. I just want to address my question because we did get to speak a lot to the residents of Limpopo, and one of their concerns is that the health system in the province is really struggling as it is. And of course we do know that a lot of these people are coming in healthy, but should the worst case scenario take place and there is somewhat of an outbreak in the province, what is the National Department's commitment towards assisting the Provincial Department of Health in terms of managing? Because of course Limpopo is vastly a rural province, and we know we've got those kind of challenges with water and health. So how is the Department of Health going to really nationally support the Provincial Department of Health should the worst case scenario take place?
Thank you very much. My name is Emmanuel Quinda, representing Energy FM and Choice FM. My question is directed to the Minister of Coast. I understand she had a meeting earlier on with workers around here, and I understand there were some disagreements and issues as well. So I want to find out from her as to what are the main issues that workers are not comfortable with. And the other question as well is referred to the Minister of Health with regard to the people who are coming here. Are you in a position to can share with us in terms of figures per province? Thank you.
All right, Minister.
Your colleagues understand what you want to say?
Can we just move the mic to the question? Because it's like a big trouble. Can we not swap perhaps like we did at the airport?
No, come. I think it's easy.
Please, it might make it a bit significant.
You can see. I'm honestly should take the economy. So it's
Okay, thank you very much. In terms of, I don't know whether you can hear me. Thank you. In terms of the meeting that we had with the workers, it wasn't the first meeting. They'd had been meetings before, but we just wanted to make sure that all their concerns have been addressed. The questions they asked were not many. One of the questions was, is it compulsory for them to work here or not? And we made it clear that it's not compulsory. They work here, but if they were uncomfortable for one reason or another, or they felt they weren't healthy enough to work here for that 21 days, it was not compulsory, and they would not be prejudiced in any way. They would not lose their job. The other issue was, should they fall sick, what will happen? And we said to them, in the unlikely event that you fall sick, you will be treated just like anyone who will fall sick here during this quarantine would be taken to a medical facility to be treated. And they also asked about safety precautions, so we explained to them. The one issue that was, should something happen to them during this period, what will happen? Will their children get anything? And that is why we had to go into a motion to check what can be done, and that's what the minister announced, that there will be insurance cover for them for a period. So, but it's highly unlikely that something will happen, but in the event it does, yes, they'll be covered. We couldn't answer that question at the time. We said to them, we are thinking of some kind of insurance, but we will confirm, and we worked on it, and indeed we are confirming now. And then there were just questions like, if I have to go to a room and do this and this, will I be protected? And we answered yes, they will be protective. If you need a mask, you'll get a mask. If you need gloves, you'll get the gloves. But generally, it wasn't like they were unhappy. They just wanted a clarification on a few issues, in addition to the issues that had been clarified before. Then they asked that they were promised that they will be examined by a doctor to make sure that they are well. And of course, that couldn't have happened earlier when there was no confirmation of this place and all the other things that had to be in place. But yes, tomorrow that will be done. And is there any other? That's all. So those are the questions they asked and we answered, and they were quite happy. Of course, they were also happy that there was some extra money they were going to get over and above their salary for this month, when the 21 days, but it will be a month, 30 days, because they weren't sure whether that money was going to be calculated on the 21 days, but we clarified that the quarantine is 21 days, but the payment would be a month. So they were very happy. That was really all about the workers here. Thank you. Premier maybe. Tourism and things. That's the next person.
Thank you very much. Those who do not know me, I'm Mamelo Kubangu, Minister of Tourism, dealing with the issues around economic impact. Indeed, the discussions in Cabinet have started around the economic impact. As you know, that we'd have to look at various sectors. You'd have picked up, Sophie, that last week we had with Santin looking exactly at that, getting feedback, and other processes have started. The DG cluster in the economy, we're meeting this afternoon to do an overall analysis, and we'll communicate, because we wanted to know, quantify the impact. We do have a sense of the economy being impacted upon. There are sectors that we know, in terms of your manufacturing, trade is affected, tourism is affected, small businesses will be affected, both because of either the trade or the tourism when things don't happen. So that is being quantified. And finally, because there were things that Cabinet has asked us to go and look at in terms of consolidating the report and making sure that it covers all the sector long term. But one of the things that we've been asked to do as a cluster, I'm the co-chairperson of the economic cluster, together with Minister Mantashe. We've been asked to go and look even at recovery plans. So it's not only about what you do, but what we can. I can assure you that there's been a team that met even this morning to look at the labor side of it with Minister Nwesi, led by Minister Nwesi, that they were looking at various sectors that we need to go and intervene. So work continues in Cabinet from various streams to look at various areas that will be affected upon, and once we are ready with all the reports having been processed, we'll be able to do. On the issue around travel ban, this is travel and tourism. WHO and UNWTO, this is UN World Tourism Organization, together with the World Health Organization, issued guidelines, obviously to say this is what you need to do, you need to put in place. There are lessons that we are learning from other countries. For example, you put a travel ban for a particular country, people then use another country to enter. So it becomes an issue that you are not able to manage your risk. So we'll continue to monitor. A decision whether to ban or not has not been taken on any of the countries. And I think that status remains until Cabinet otherwise. And you would have noted even the President has pronounced on that this week to say that South Africa has not taken a decision to ban. And maybe just to explain, if you look in terms of travel and tourism, you'd find there are various categories. You either issue a warning to a country to say this is what happens. So I think for South Africans, let's not think about extreme issues, but maybe perhaps all those issues. That's why continuously it's important to listen. As the situation develops, the IMC will take decisions, and then media and the public will be notified. Thank you. Yes. Oh yes. DERCO is working on advisory, as I was saying, that it will not be bans but advisories. So advisory notices will be issued. They are issued on the website of DERCO as the custodian of, in terms of those travel advisories, as in terms of the diplomatic channels.
And also just the advisories also the other way, advising South Africans where the problems are. Because if you look at the cases we have now, all of them are South Africans who went out to particular areas. It's not to say they shouldn't go there, but it's to advise them that if they go to this place, they must be very careful. This one, if possible, they must avoid. So it's advisory from South Africans who want to go out, but also what she has explained of people coming in.
Thank you, Minister. Sophie, you're asking us to what is it that we are doing as a province. Remember, this is a joint exercise. It's a joint exercise that involves both the province, local government, and the national government. So we have already started embarking on a process of conscientizing our people, driving awareness exercises throughout the province currently. We are going to distribute pamphlets with effect from this Saturday. We are actually awaiting the printing of pamphlets or leaflets, what you would call leaflets. We met with one of the big churches in this province today, Bishop Lukhanyan. We met with Bishop Lukhanyan, and we have assured him that come Monday we'll be giving him almost 1 million of those pamphlets so that he can attend to or distribute them to the pilgrims who will be coming for the pilgrimage during Easter weekend. All MECs, all cylinders are open, they are all firing. All MECs have been actioned to do exactly that. We are also communicating with our mayors so that it should not only be MECs, even councillors must be on the ground and make it a point that people are made aware of this. I think that was the only question. I think that has been clarified by the minister when he said people when he explained as to what kind of people are we bringing here. There is nobody who will be coming here who will be sick. Anyone who will be sick, it will be a responsibility of the minister who will come in and take him or take her to a medical facility. May not necessarily be in this province. But those who are here, who will be coming here, are healthy people, all of them. So whatever resistance that may be coming from whatever angle, like I said, we are actually communicating with our people, even from other structures, like, for example, your ruling party. The provincial secretary was on radio not long ago, distributing or disseminating this message that, look, there is no coronavirus that is being brought here. It's just that these are citizens of South Africa who are being brought here. And we are just embarking upon a humanitarian process. Nothing else, nothing less.
Thank you, Premier. Colleagues, thanks, colleagues. Let me start with a question. When did the provincial government know? Well, actually, the MEC was contacted late on Sunday, MEC for Health. The Premier was only informed on Monday. The Interministerial Committee, this one, only heard on Monday. Myself, I got the report from the generals on Saturday that the rest of the other areas are not suitable. This is the only one that they were coming to. That's when they sent me a report. It was sent to me on Sunday to say, we've looked at everyone, this is the only one we're going to take. So when we said to you we didn't have answers, we were quite correct. We didn't have the answers. We were waiting for the generals. Actually, it was interesting, and I'll say this, because I had a discussion with General Dabula, and I said, okay, we'll send the team to go and check what you looked at. And then General Dabula said, no, all the 3 generals who went there got a report, they're not going back again. We're done. So I said, okay, show us the report. Then they sent us the report. We're happy with that because they are the ones who are assigned. As far as we're concerned, it was to give them support. The Premier was quite surprised. Oh, you are here. We didn't know, and we said we also didn't know. It was the generals who were actually assigned. Now, you know, when you're dealing with the issues of the army, you must respect their protocol. That's what we did. And so, you probably would have heard a lot of people making comments. Those comments come from the fact that neither the Premier, nor the ANC leadership, nor the government of Limpopo had prior knowledge, nor the interministerial committee, nor myself, who was assigned to liaise with the generals. We didn't know. But we didn't need to know. We're not the ones who were planning. We're supposed to receive the report. And that's what happened. So if you want to know when they were able to procure the aircraft, we don't know. They just told us, listen, we're ready. Then we're fine. Then we said, okay, what about the crew and the pilots? That's all that is done. That's it. So as far as we're concerned, we understand that the army is running this show, and we're not going to stand on the way of the army. And the province, we've gone through and had a discussion. A province, particularly Premier and the MECs, they only got a proper briefing just recently. They were not aware all along, but neither were this committee aware. So we allowed that space because we did say there are planners who have been assigned, and those were the ones. I want to just deal with that aspect, and then there's another question that was raised. How many people come from where? Well, let me say that all of them come from South Africa. There's no one who comes from somewhere else. They're all South Africans. But I can give you a breakdown. Okay? Gauteng, 22. Western Cape, 13. Eastern Cape, 6. Free State, 55. KwaZulu-Natal, 9. Limpopo, 7. Mpumalanga, 7. Northwest, 2. Northern Cape, 0. Total 121. The next question you asked. Griselda, how do we trust you now? You change, you say this, you change. Well, we're human. When we make mistakes, we'll upfront say that was a mistake, we'll correct it. If people are going to be upset with the fact that the figures are changing, we apologize. But we can only give you what we have at the time. We undertook to the public that we'll give you the results as soon as they arise. We decide that is safer than to spend a long time verifying until the matters leak. Because that will give you a problem to decide what is fact, what is fiction. When one time we don't tell you that someone was supposed to be, was suspected in the Free State, and then people talk about it, and we then come back and say, well, no, it's not true. Then you'll say, well, what do we believe? Now, this is a situation, we're damned if you do, we're damned if we don't. We will stick to the truth. And we'll give you the truth as we know it. Let me give you a bit more background as well. Because you might just want to wonder, why is that happening? Firstly, patients who have up to now been diagnosed didn't go to the public hospitals. They were actually diagnosed by private doctors. They take their tests to the private laboratories. The first few, we took the laboratory tests, and then we did the tests ourselves. Then slowly, the private laboratories have been beginning to develop their capacity. When they did that, we made a very firm condition that the only results that will be accepted will be verified results from the National Health Laboratory Service and the NICD. So before the tests get to be done by the NHLS, there would have been a test done earlier. And the basis of it, if I can just explain, if you've got a flu, there are many viruses that can be liable. So what the doctors do, they screen for the rest of the viruses. Then they say, let's also check if there's coronavirus. But we will not say that is final until it goes to the government laboratory. Even now we insist, no verified result will be accepted unless it has ultimately come to the government laboratory. Okay? So what has been happening in the past few days, we've been decentralizing and saying let's increase the sites where people can be tested for coronavirus. These are experts, they are virologists. So an ethical issue arises. The question is, if the first laboratory finds a positive result and then say this result must go for verification to the government laboratory, as we have said, what do we do with the results? What do we do with the patient? Do we advise the doctor? The doctor says, you've checked the HPV, it's not there, you've checked the influenza virus, is not there, etc., etc. What about coronavirus? What did you find? Then the laboratory is obliged to say, we found it positive. However, it has to go for verification. Now, no doctor will sit with a positive result and not warn the patient. So as soon as the staff knows, then the issue arises that you can't let that situation go as though you did not get that result. So when we released the result, it was released at a point where the verification had not been done, but it was also at a point where the doctors had been already alerted that there is a problem in this one. You rather err on the side of caution, warn the patient and tell the staff, take extra precautions, start tracing the patient for the contacts and so on. So don't wait for the date of the verification, you start the work. In order to start the work, you have to actually declare the results that you get. And in this case, as the second time it has happened, you then find that the test comes back negative. We accept that as the result. In between, a statement has gone to Griselda Lewis at SABC. And the problem is, when that happens, the public must be explained to that now and again you will find those flaws, and when that happens, we'll just apologize and correct it for you and move on. So it's not a huge thing. Those who work with patients will understand this issue. And to correct this for good, I'm having a meeting on Saturday with all the laboratories, private laboratories, so that we can sort out and align the protocols so that we must be able to tighten up this particular issue. It's the same issue that happened on Monday. It just so happened that our press conference happened a bit later. I got the result literally as I was sitting on the table. It could have been reported exactly the same. So please just let's alert the public that those issues will arise. When they do arise, it's not a problem. It's just that we must just correct it. So that is really the issue. So you shouldn't feel that there's a crisis of credibility. There isn't. We still... Yes. It happens in football and rugby there, you see. You go back and check. You see. That's what happened. Then the other issues have been answered by my colleagues. For example, the issue of the economic impact. Cabinet discussed that issue. We didn't come to a conclusion. Further work is being done. The Interministerial Committee is going to look at it again and then submit to Cabinet. So we are aware that there are serious challenges. It's not our economy, it's the world economy that's been affected. And so we are aware of that. The other issue is that the reason why we want to see that is because it's important for us to ensure that we're not complacent but we also don't act on the extreme side. We need to try and get a balance. We think there are many examples in the world so that we can try and pick the best way to try and navigate. That's really why we're taking time on that. It's not late. Remember, the countries we're talking about Italy's got a lockdown, it's got 8,000 people. You're talking about US, they've got close to about 600-700 people. You talk about Korea, they've got 7,000 people. You talk about South Africa, we've got 16 people who are coronavirus positive. So not that we've got a lot of time, but we're simply saying let's thoroughly analyze and pick the best choices for South Africa. Because there's no action that's got no consequence. So we really are going to try and navigate through. Remember, no one has ever had to face this kind of situation. So because of that, you'll raise issues, we think about them, everyone raises issues, we find a way to how we're going to deal with this. So you ask the question, how do you minimize? We're going to have to really selectively pick up best combination. The Premier talks about, we were meeting up with ZCC today. They're going to continue to meet other churches. On Thursday next week, we're meeting South African Council of Churches with all the churches that they can find. We're going to discuss the issue. Now, the challenge here is that, if you were to go by the law, the simplest thing is, if you want to prevent the infection, the simplest thing is this: listen, cancel Good Friday, cancel this, cancel that. It's not as easy as that. You also can't make restrictions unilaterally. We don't run the churches. We have to support the churches. We have to enlighten people and so on. The bishop was very, very appreciative that we were able to share. We're going to do exactly the same thing next Thursday. And when we do so, we basically are saying, let's look for solutions together. It's the churches that must look at it. It's the artists. It's everybody that must look at it so that we can come up with a solution. Maybe the media, if you've got suggestions, tell us. So we will also consider all of those issues. Then, how much are we paying rent? Why must we tell you? Because we will only know when the bill comes as to whether we pay more or less than what we did. So we will not be able to give you that until we're done, then we'll give you the statements. Somebody asked a question, how do you pay so much just for 100 and something people? Well, sometimes we pay hundreds of thousands to save one life. We never ever say it's not good enough to save one life. If that's what it calls on South Africa to do, to rescue its citizens, South Africans are ready to actually rise to the occasion. If it means there's a risk to those who are going there, they are prepared to take the risk to go there and fetch them because these are fellow South Africans. I think we must actually never lose the fact that we are one family, we are one nation, we belong together. And when situations like this arise, they are actually the situations in which the best of our humaneness needs to come out. Sometimes it will cost us money, but at the end of the day, we'll all go back home and say we did save one South African, whatever the cost was. And so in this case, we believe that the mission cannot be faulted. It's a humanitarian mission. It's to save South Africans and bring them here, but not that they were so badly treated and sick there. They just asked to come back home. Is that a sin? It's not. So let's really understand it for what it is. It's not that there was a problem with the way Chinese have done a good job treating people there. And if someone was sick, would have said, get treatment in China. When you are better, you'll come back. And we'd say so because we know China has actually treated 80,000 people, and 60,000 of whom have recovered from the infection. No other country has done that. So we must just understand the context of our people coming back as South Africans. They must find us willing and ready to welcome them. And so we mustn't publish things that create an impression that, we rather condemn them. No, they're not ill. And they're also when they want to go home, where should they go? So that is really what cabinet has to raise. A few of the comrades, here, and the first plea came from Minister Pando, and today we're talking to some of the MECs, and some of them were saying, you know what, I'm a mother. If my child is worried they might get ill and they're away from home, how do you expect me to relax? If they say, Ma, today I didn't eat, or I'm not happy, I'm uncomfortable, the family can't relax. So that's really what we are dealing with. So I think as we are taking this whole process forward, this is just one aspect, the evacuation and quarantine. It's just a small aspect on fighting this thing. The real fight that's awaiting us is the fight of trying to reduce the number of infections, break the cycle of infection, and make sure whoever is sick recovers, and make sure that South Africans can look back and say there was coronavirus, but we survived, we defeated it, and if we work together, we'll be able to do that. Thank you very much.
All right, colleagues, we will take the last batch of questions.
Oh. I thought we were done. I thought we were done. Okay.
I see three of
you. Can I make another piece of paper? I'm prepared.
Just, you kind of touched on it earlier, but just to detail, there's been some stuff on social media, people have said things and statements. What is your response to people that might want to interfere with these people being brought to this venue safely? You've already spoken about people's concerns, but what is your message to people that might want to intervene or feel that it's
going to happen? Just take us through from the time that
Minister Dr. How many people are employed here? How many workers decided to take the offer to continue during this quarantine period, and how many decided to go home and come back later?
My name is Makubo from SBS Credit. I just want to double check. The road has been closed in the final one. It will be closed for how long? Is it going to about 21 days?
Over to the panelists.
Are we done?
Yeah, we're done with the questions.
Is that the last round?
Yeah, these are the last round.
Okay. Thank you. Come this side, Minister. No, sorry. No. Come to this side.
Road closed. You saw that, Magiti. No, that's good. Now, as the Minister Mkhize said, this is a military operation. Soldiers are leading and police are supporting, because soldiers don't have soft methods of dealing with matters. So you bring police to be a little bit softer. This road, this place has been completely taken over. It was initially taken at 12 by the police, but the South African National Defence Force took it over at 6. So, as you leave here, please don't look back. If it happens that you look back and we find you, we'll quarantine you for 21 days here. If we find you sneaking around and too close and you cross the lines, yellow and red, we'll put you in for the next 21 days. Goodbye from here, go. The roads won't be closed because the place has been taken. The issue that time, there was some threat of people that wanted to come and disrupt and all that. So we had to make those blocks so that the place is secured. But now it's fine and all that. I think your answer too, that how long and all that, yes. said military, yes. Police, yes. If you break the law, there is law. Police are there. You read your proper section 205 of the Constitution. What is the job of the police? It's to protect the law, investigate, defend the law. People that will come here to disrupt, I don't know who asked that question. But if they are, say hello to them. If you cross the red, Minister has explained that the defense had to find the place that it will be easy to put two lines, the red and the yellow. It's the outer one and the inner one. If you cross any one of them with your placard, you will keep your placard here for 21 days. And we feel that you have come too close to such an extent that you want to belong here. You don't have a problem staying here. Minister Mkhize has explained that it's not 121 people. Many other people, crew and everybody. And those that they think they can break the rule and all. Let me repeat, this is a military operation. So once the CIC calls the military operation, normal laws are suspended. Normal laws are suspended, and we deal with it as such. Thank you very much. See you next time, but not yet.
Be careful, there are lions.
The question about the numbers, and we asked to see the workers. They came, they filled these chairs. We spoke to them. We did not ask how many they are who work here and how many are not going to work, because that's for the people who run this place to take care of that. We were just here to make sure that the workers understand their responsibility, they know their rights, and we take care of their concerns. As for the numbers, those who run the place, the ranch, will know that. Thank you.
The staff here that was declared for the purpose of this work is 120 people. However, as Minister Dlamini Zuma says, we're not aware of anyone who wants to go. So really what they were discussing, as Minister says, was something to do with just allaying their anxieties and sorting out what they thought was outstanding that needed to be clarified, and that's really all that we have. And I think the point that you got about people who said they might want to come and disrupt, the Premier did indicate that they'll be talking to all the stakeholders. Those things are not things that we worry too much about. What we understand is they are trying to explain is the anxiety that we need to go and meet with them and allay. There is no risk to their lives by this process. And therefore, because of that reason, it means if we hear that, it means we must go and talk to them to say, no. There's actually no reason why you should do that, because there's no coronavirus outbreak here. But also, coronavirus is going to come whether we like it or not, and we just need to be alert so that we know how to reduce the devastation from the virus. And it is possible, and we really want to go all out and make sure that we talk to all the leadership so that they must lead in the fight against stigmatization of people who have got the infection, and also defeat fake news and make sure that the correct information about the virus is understood so that people can take the necessary precaution and responsibility to ensure that they are safe and no one else is infected. With those, ladies and gentlemen, we want to say thank you for your interest, for your time, and for your patience, and for your reports, and for sure, we really believe that this matter, for us to fight it together with the media and society in general, it has to be fought like that. there's one side, it's South Africa one side, it's a virus and fear of the virus and stigma on the other side. We must work together on that. Thank you very much.
Thank you very much for this. We'll go with positive news now.
Yes. I want to confirm again, tomorrow there's nothing.